Hi, I'm Emma with Epilepsy Alliance Ohio, and welcome back to our mini-series on epilepsy, where we explore a wide range of topics to help you better understand epilepsy and how it impacts lives. Today, we're diving into an important topic of health insurance. Whether you're new to the world of health insurance or you've been navigating it for a while, it can be tricky. And if you have epilepsy, understanding your health insurance is even more important to ensure you're getting the care that you need. So let's break down the basics, what you need to know, and how to make sure your epilepsy treatments are covered. Let's get into it. Start by breaking down some key terms that you're going to see when looking at your health insurance plan. Understanding these can save you a lot of confusion later. First, you've got your premium. This is the monthly payment that you make for your health insurance. Think of it as your subscription to the insurance plan. Next is the deductible. This is the amount that you have to pay out of pocket for your health care before your insurance starts to cover more costs. For example, if you have a $1,000 deductible, you'll need to pay that amount out of pocket before your insurance kicks in more. Then there's the copay. This is a fixed amount that you pay for a specific service, like a doctor's visit or a prescription, after you've met your deductible. Your out-of-pocket maximum is the most that you'll pay in a year for covered services. Once you hit that amount, the insurance company will cover 100% of your care for that year. Lastly, you've got in-network versus out-of-network. In-network means your insurance company has agreements with certain doctors or hospitals, so you'll pay less for those. Out-of-network means that they don't have agreements and you'll likely pay more. You've got some key terms down. Let's talk about different types of health insurance plans that are out there. Knowing what you're eligible for is crucial. First, if you work for a company, you might have employee-sponsored health insurance. This is a health insurance offered through your job, often with the employer paying part of the premium. This can be one of the more affordable options if it's available to you. If you don't have insurance through your employer, you can check the Marketplace health plans. These are plans that you can buy directly, especially if you're eligible for subsidies through the Affordable Care Act, or ACA. They come with different levels of coverage: bronze, silver, gold, and platinum, so you can choose one that works for you. For people with low income, Medicaid can provide free or low-cost health insurance. On the flip side, if you're over 65 or have certain disabilities, you may qualify for Medicare, which is a federal insurance program. People with epilepsy may be eligible for these programs, so it's worth checking out. Lastly, some states offer their own health insurance programs for people who don't qualify for Medicaid or Medicare, or who may need extra help. These are specific to each state, so you'll need to check the state's website for more information. Let's talk about your treatments. If you're living with epilepsy, your treatments might involve medications, doctor's visits, or even surgeries. But not all insurance plans are the same when it comes to covering these things. First off, generic versus name brand medications. Generics are usually much cheaper than name brand meds, and most insurance plans will cover them. But if you need a specific brand for your seizure medications, that might cost more depending on your plan. If you see a specialist, like a neurologist, for your epilepsy, you'll likely have to pay a copay. Be sure to check if your specialist is in-network because that will save you money. If your epilepsy treatment requires surgery, make sure you check whether it's covered. Some insurance plans cover surgical procedures related to epilepsy, like brain surgery or vagus nerve stimulation. Lastly, therapies like physical therapy or even counseling for coping with epilepsy might be covered. But it's important to check if there are any limits on the number of visits or types of therapy that your insurance will cover. Living with epilepsy means you're probably familiar with emergencies. Let's talk about how insurance covers those types of situations. If you need to go to the emergency room due to a seizure or a seizure-related injury, it's important to know how your insurance covers it. ER visits can be expensive, but most insurance plans will cover emergency care, though there may be some out-of-pocket costs depending on your plan. If you need an ambulance for an emergency, check to see if it's covered. Ambulance rides can be costly, and not all plans cover it fully. If you're in a state with specific epilepsy coverage, they may offer better coverage for ambulance services. Some people with epilepsy use seizure detection devices or monitors. These can be a game changer for your safety, but you'll need to check if they're covered under your plan. It may depend on whether your insurance classifies it as a necessary medical device. Finally, let's talk about what to do if your insurance claim is denied. Sometimes insurance companies won't cover something that you feel they should, so here's what you can do. First, read the denial letter carefully. Insurance companies must tell you why they denied coverage, and this is your starting point. Next, gather all supporting documents, doctor's notes, prescriptions, and treatment plans. These can help prove why the treatment is medically necessary. Third, write a clear appeal letter. Be specific about why you believe the treatment should be covered and include your supporting documents. You can even ask your doctor to write a letter explaining the importance of this treatment. Finally, keep detailed records of all your communications with the insurance company, including phone calls, emails, and letters. This can help you in the future if you need to escalate the issue. There you have it, a basic guide to understanding health insurance and how to make sure that you're covered for epilepsy treatments. Health insurance can feel complicated, but knowing the key terms and options can make it a lot easier. If you found this video helpful, don't forget to hit that like button, subscribe, and leave a comment if you have any questions. You can contact our main office by calling 513-721-2905 or emailing EAO@epilepsy-ohio.org. Stay healthy, and I'll see you in the next video.